All right, you good? You want to get started? Okay. Let's see if I can get. Okay, we're going to go ahead and get started. Good evening. This is our first webinar for Guiding Star at the Shores. My name is Felony Joe, and I am the current executive director and one of the founding members for the Guiding Star Center in New Jersey. Guiding Star at the Shores, a national project, is rooted in the conviction that women do not receive adequate healthcare services when they're faced with the current standards for mainstream women's healthcare. Guiding Star at the Shores is an alternative, and we are ready to meet women in their unique journeys and welcome them into our community with one-stop lifetime access to our services and resources. Tonight, we are featuring Lydia DeCastro. Lydia is a mom and certified doula, as well as a childbirth educator. She is a retired Coast Guard member, as well as her husband currently serves in the United States Coast Guard. So we thank them for their dedication and service in our armed forces and protecting our borders. I'm going to be turning this webinar over to Lydia as she introduces herself and provides you with some education and support for affirming a culture of life.
Okay. All right, can you all hear me?
Yep.
Can you guys see me?
Yes.
Perfect, okay. Hi, my name is Lydia DeCastro. Thank you, Felony, for the next introduction. I am a native of Connecticut. I'm an active duty member. Well, I was a former active duty member. I separated from the Coast Guard in 2018 after 5 years of active duty service. Currently live in Southern New Jersey. And here I own my own small business. I'm the owner of Magnificat Birth Services, where I provide childbirth education and birth doula services to the South Jersey area. I have 4 years of experience as a birth doula. I became a birth doula while I was still active duty, and it was not something I was really interested in doing. It was something, well, I was interested in doing it, but it was not part of the plan, let's just say. But I have been doing it for 4 years, and God definitely has guided me along this whole path, because I was planning to be a lawyer. I wanted to make big bucks, and he kept pushing me in this direction. And after a while, it became clear to me that this is what he was calling me to do, is to help women during their pregnancies, their births, and their early postpartum phase, and help them have a smooth start with everything. So that being said, I will save your questions for the last 15 minutes. Basically, the purpose of this webinar is to give you guys some basic tools. I have been attending many births over the past couple of years as a doula, and the purpose of this webinar is to give you my top 4 comfort measures for labor, and to go over some COVID-19 specific information. There is a lot of, I would say, misinformation out there about how this virus affects pregnant women and infants. And I wanted to provide you all some information, so that way you know what the evidence is, you know what we currently know about the virus and how it affects mothers and their babies. So, that being said, I'm going to get started. So, the first thing I'm going to talk about is my top 4 comfort measures. And I'm going to be looking periodically at my notes just so I don't miss anything, because I want to make sure that y'all get as much information as you possibly can. So that being said, my top 4 comfort measures are personalizing your birth space, movement, breathing, and water. I use these pretty much in every birth that I attend, whether that be the 2-day all-natural first-time mom labor or the 15-minute multip, or multip is a mom that has had multiple babies birth. I use these pretty much every time I attend a birth. Oh, and just as a side note, if you're not familiar with what a doula does, I am a non-medical birth professional, so I'm not a nurse or a midwife. My job is to coach women through pregnancy, labor, and the postpartum period. I'm kind of, the best way I describe it or summarize it to people when they're curious is I'm a birth coach. And I coach women through each breath in their labor. I coach them through the breastfeeding process. I'm kind of like that best friend that has all the answers and a lot of experience in birth. All right, so the first one I mentioned, well, let's talk about personalizing your birth space. You might wonder, what does that mean and why is it important? So personalizing your birth space, that means making your birth space as comfortable and compatible with the birth process as possible. Why do we want to personalize the birth space? Now, whether that could be your home. A lot of women nowadays, because of the pandemic, are choosing home births because they see the hospital setting as a way to expose themselves further to the disease, and they'd rather be at home if they are low risk. But I would say for the most part, still, most women are choosing to have hospital births. All right, so whether that's in the hospital or at home, it is important that you feel comfortable and safe in that birth space. The reason being, there is a specific hormone called oxytocin. Oxytocin is the love hormone. It's also called the happy hormone. Oxytocin is the hormone that fuels uterine contractions and makes them start. It is also the same hormone associated with the female orgasm, eating chocolate, drinking wine, cuddling, recognizing people that you love, petting a dog. All of those things promote oxytocin. It's feelings of happiness, safety, comfort. So oxytocin is a hormone. All those things, oxytocin is the hormone that fuels uterine contractions. It causes your uterus to contract. So what we want to do is bring all of those things that cause our bodies to naturally produce oxytocin into our birth space. So the way I kind of like to describe it to my moms when I go into a birth, if you couldn't make a baby in that room, you probably won't have your labor progress. So what does that mean in the birth space? That means dim lights. I usually, when I go to a hospital birth, I will shut off all the lights. I bring a string of Christmas lights. So just dim lighting. So we can see, and the nursing staff can see things still, but it's not those very sterile, bright hospital lights. Calming, relaxing music. Maybe consider making a playlist of music that comforts and relaxes you. For me, I did praise and worship music. I did Gregorian chant. It's just things that made me calm. Classical music, that's another thing that I did during my births. Aromatherapy. If you are someone that uses essential oils or just loves the smell of lavender and it really relaxes you, bring a diffuser, bring some essential oils. You want to keep yourself relaxed, feeling happy and comforted. Another thing I'd like to note is minimizing the amount and type of people at your birth. In the hospital setting, that could be as simple as, let's say, asking, hey, you know, I would only, let's say you have a whole bunch of nurses in, or you have interns trying to come in. Do you guys still see me? Cool, okay. So instead of having, let's say your doctor wants to bring interns in, or you have maybe more than one nurse in there at a time because there's not a lot going on the labor floor, you can respectfully, nicely just ask, hey, you know, we just have whatever nurse is assigned on staff to us and not have all these extra people. And that being said, if you also have a nurse that isn't especially kind to you, or let's say you have just a nurse that you don't really feel comfortable with or said something that puts you off, that can actually stall your labor progress. And it is perfectly acceptable, and I've had clients do this before, where they will go out to the service desk and say, hey, would it be possible to get another nurse on staff? And typically this is something I tell the birth partners, the dads, the boyfriends, or the moms that are attending the birth with their daughter, to be that, I call it the goalie. You're the one that's advocating for and protecting that space for the mother, the birthing mother. Okay. Another thing you can do, eat chocolate during your birth. Bring a chocolate bar. I had a client recently do that. She loves chocolate. It makes her happy. And she brought it to her birth. It's also a great source of energy. You can incorporate massage. If you're someone that likes to be touched and massage relaxes you, talk to your birth partner. And when I say birth partner, that's just anybody who's in the birth space with you. Typically that's a husband or a mother of the birthing mother. Incorporate massage. I also had a client recently, she loved her grandfather, and her grandfather recently passed. She brought his funeral card with a prayer on the back, and she looked at him, and just seeing that picture just promoted good feelings for her. Just recognizing his face reminded her how much she loved him, and saying that prayer on the back of his funeral card really helped her in her labor. If you have comfort items, maybe I have some friends that have brought like stuffed animals to their births that they've loved and always had with them. If you're having a home birth and you really love your dog, have your dog there. This may sound ridiculous to you, but I'm telling you it works. So do your best to surround yourself with things, items, smells, sounds that make you comfortable and happy, because overall that's going to be what helps fuel your labor and prevent it from stalling. I do want to, before I move on to the next topic, I do want to address how important it is to have the right, someone texted me, I apologize for that. It is very important to have the right people at your birth. Just as an example, if there is somebody, let's say, like for example, my mother-in-law wanted to be at my first birth, but my mother-in-law, I love her to death, but she doesn't really reinforce feelings of calm in me, if that makes sense. Or maybe maybe your sister had you attend her birth, and she's just assuming that she's going to be at your birth and help you through the process. But every time you're around her, she's somebody that's very competitive or that just makes you feel uncomfortable. Probably not a good choice to have at your birth. And the reason I say that is negative people or people that cause you to be agitated or stressed will cause your adrenaline to rise during the birth process. And adrenaline directly contradicts oxytocin production. So we want to prevent adrenaline surges in the early phases of labor. If you guys have any questions about that, feel free to wait till the end and we'll have a question and answer session about that. But I think that it's an important note to make, because I've seen women's labor stall. And as soon as that person whether it was their mother or sister, left to go get lunch, their labor immediately progresses. So just something to think about. I'm sorry, my screen just diminished. Hold on, I apologize. There we go. Okay, so we just talked about personalizing the birth space. That's number one. Number two, water. Think about incorporating water in your birth. Personally, for me, I labored for both of my births in the tub, and it cut my pain level probably about 50%, which made it a lot easier for me to cope, because the hot water, think your uterus, the muscle that is contracting during labor is a muscle. Just like a hot compress helps you when you work a little too hard at the gym, or taking an Epsom salt bath helps you after you've had a hard workout or run a triathlon. The same thing is true in labor. It's an athletic event. It's a muscular activity. Being in warm water not only relaxes you, but it helps those muscles relax and those tissues relax, and it makes the process a lot easier on your body. It also laboring in the water also reduces the need for epidurals. If you're somebody that's trying to have a birth without an epidural, That's a really good route for you. It shortens labor on average by about 30 minutes if you labor in the tub, which is great news. There's also there's a lower chance of you tearing your perineum if you labor in the water and you have a water birth, which is great news. Unfortunately, full immersion water birth is not usually an option. It really depends on where you live. Typically the Midwest, California, Texas has a bit more water birth. Here in Southern New Jersey, there's only one facility that promotes water birth. If you're doing a home birth, obviously that's an option. But even if you're in the hospital setting, you can still, I've been a doula in 4 states and there has not been a single hospital that I've attended a birth at where you could not at least labor in the water. All right, so sorry, I got distracted by the chat. You guys will have to forgive me. All right, so if you're in the hospital, go in the shower. If you can labor in the tub, great. A lot of times too, gauge your provider's comfortability. If you're having a hospital birth, gauge your provider's comfortability with you laboring in the water. A lot of hospitals will have certain criteria that you have to meet for laboring in the water or birthing in the water. Make sure you know what those are and ask those questions early so that way you increase your chances of having that happen. But let's say even if you can't labor in the tub for whatever reason, or you can't birth in the tub, you can still use the shower head. Pretty much every hospital has a shower with a shower head. Go in the shower. It's still hot water. It's not as, I will say it's not as effective as a full immersion bath, but it's still pain relief. It's still muscular relief. A lot of births in hospitals that don't allow laboring in the tub, where they don't have a tub in the bathroom at the hospital, I will take the shower head, they're usually removable, and just spray them over the laboring mom's belly or her lower back. That's especially helpful if you're having back labor, or just over her hips. Typically I find moms know where they want the pain relief. Great option. So just take that shower head off and direct that hot water directly on the lower back. It works great. I do want to note though, if you are a first-time mom, I would hesitate going into the bath if you're not already in active labor. The reason I say that, and this is from personal experience, again, I am a non-medical person, but this is something that I have seen frequently in first-time births, including my own, and that is generally accepted in the birth community, that if you go into the tub in early labor that's not quite well established yet, it can completely stall your labor for a while, and then you're going to have to work very hard to pick up contractions again. So just be cognizant of that. If you are not contracting, I would say every like 3 minutes, and you're not quite zoning out, I call it labor land yet, and you're still talking and you're communicating, you might think that they're intense, but if you're not completely in labor land, zoned out, completely zoned in on those contractions, where they're at the point where you're going, okay, this is very serious, and you're, I would not, if you're a first-time mom, get in the bath. I've seen it stall a lot of labors, including my own. If you are a multi-mom and has had multiple births, I would say generally that it is okay to be in the tub during early labor, but just be aware that it can make it go very fast. It's funny how different the body responds to different things given how many children you have. So depending on how many children you have and how familiar your body is with the process, it reacts differently to different things. But I would say generally, if you're a first-time mom, wait until you're in active, well-established labor before you go into that tub. And if you have questions about that, wait to the end and we'll address them. Okay, so now that was my number 2. Number 2 is water. Number 3, we're going to talk about breathing. I know a lot of you probably are familiar with Lamaze, something that came around at least when my mom was having babies, and it was fairly popular. I have never done Lamaze. I've heard it's fairly effective. But the method that I use with my moms is just deep diaphragm breathing in through your mouth and through your nose and then out through your mouth. I actually have found that that's the most effective for me personally, and all all the clients that I've worked with. So why is breathing important? Your breathing sets the tone for the rest of your body, if that makes sense. If your breathing is controlled and relaxed, your body and your mind are going to be relaxed. Your body and your labor will follow suit. I've seen a lot of times where moms will get to very active labor or transition. And if you don't know what transition is, that is when your body is dilating from 7 to 10 centimeters. That last little bit, contractions typically are every 2 to 3 minutes, and they're lasting about 90 seconds. And always, 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 that's when moms say, I can't do it. This is too much. I want to go home. I want to have a burger. I don't want a baby. I don't care. It's very hard to deal with as someone who's been through the process before. It's a very hard moment. Typically I'll see at those moments moms that have previously been handling their breasts well and regulating their breasts and been as relaxed as possible during contractions will lose it at that point. And they need somebody in that moment to just breathe with them. Don't say, all right, just take a breath. Because she might get, if you're a laboring woman, I know when it was me, I nearly bit my husband's head off when he said that to me. But just having someone rein you in and breathe with you, and typically whoever you're planning on being with you during the birth, whether that's your husband, your mom, your sister, your boyfriend, just give them the tidbit and say, hey, if you notice me starting to hyperventilate or breathe very quickly and lose control of my breath, just rein me back. And it's a very easy process. In fact, I'm just going to talk you through it right now. All right. So all together, just make sure you're seated in a nice chair, straight up, your feet on the floor. And whenever you're ready, just take a deep inhale through your nose, hold for a few seconds, and then exhale through your mouth. Now, what I want you to pay attention to is my jaw. And I'm going to explain why that's important. You want your jaw relaxed. There is a famous woman in the natural birth world. Her name is Penny Simkin. And she says when one orifice is relaxed, as in the mouth, the urethra, the vagina, the rectum, they all are. So, and excuse the language here, but this is the best analogy I can give. Think about when you have a really big bowel movement. Do you sit there on the toilet and push like this? Or do you just naturally find that your mouth is open and your jaw is relaxed? I bet you that's what you do, isn't it? And also, did you ever notice that sometimes when you pass a big bowel movement, a lot of times you'll also pass urine? That's because all of your orifices are relaxing. Birth is the exact same thing. And if you've ever had a baby before, it really does feel, I've had an epidural birth and I didn't feel anything. I've also had a natural and medicated birth. And I can tell you that natural and medicated birth, even though I had seen it 1,000 times, I said, I'm pooping. I have to poop. It was really the baby, but that's exactly what it feels like. Okay, so very important. One orifice is relaxed, the rest are. So deep breathing in through the nose, out through the mouth, relaxed jaw. Just tell whoever is going to be at your birth with you to look for that relaxed jaw, because that will mean everything else is relaxed. And on that note, we talked about transition, right? Typically during transition, you are going to feel the urge to make a sound, just express things. Some women don't, and they don't feel the need to, but a lot of women will start making either high-pitched sounds or low-pitched sounds. So I'll just do a quick breath demonstration. So typically how this will go is mom will take a deep breath in and she'll go, ah, or some kind of vocal noise. Lower tones are better. Lower tones, so relaxed jaw and lower tones is what I want you to think of. So kind of a noise like, ah. Reason being, high-pitched noises naturally make humans clench and tense all their muscles for whatever reason. So if you're making high-pitched noises, your body physiologically is clenching and stressing and tensing also. Whereas if you have a relaxed jaw and you're making low toned sounds, you're relaxing your body, you're relaxing your jaw, and your body's not clenching. If your body is clenching and all your muscles are clenching, again, the uterus is a muscle, your perineum is tissue, all those things are tensing, and it's going to directly work against the physiological process of labor. Now, even if you have an epidural and you're not having contractions, deep breathing will really help you during the pushing phase. When you get to the pushing phase, you have to, for the most part, most women have to be coached through the pushing process because they don't have the sensation of pushing. And taking good deep breaths in between those pushing contractions is very important. It gives you oxygen, gives your baby oxygen. If you have any questions about breathing, wait to the end, but that's number 3, breathing. All right, now we're getting to the 4th one, and that's movement. Now, whether you are just planning on doing early labor naturally, and then once you get to the hospital and you're in active labor, you plan on getting the epidural, or whether you're planning a completely natural birth, whatever you're planning, even if you're getting the epidural, there are movements that you can do that'll help your labor to progress, even in the hospital bed. Movement is critical. So things I want you to think about: open pelvis and upward, if that makes sense. So if you're birthing, however you're birthing, I find it's really funny. Women left to their own devices typically find the positions that actually are physiologically best for their labor, if that makes sense. For example, a woman that is unmedicated, that is in early labor or even active labor, typically if you, like when I come and see people, I find them leaning over forward on something and kind of swaying back and forth. They don't know why they're doing they don't know why they're doing it, but they naturally got themselves in a very conducive position to promote the labor process. And I'll explain why. So upright positions are great. If you are laboring without an epidural, just being upright in general, sitting upright, standing, leaning forward on something is great. Sitting on the birth ball. Reason being, the best way for a baby to exit the birth canal and navigate through the pelvis is the occiput anterior position, meaning the fat part of the baby's head, this occiput, is to the mother's front. That's the heavy part of the baby's head. Leaning forward naturally moves that baby's head to the forward part of the mother because it's the heaviest part. So if you're leaning forward, heaviest part tends towards the front. Makes a lot of sense. So it's just funny, like I said before, women typically find themselves in that position anyway, and in upright positions. And it's honestly the best thing that they could do for themselves. So best ways to facilitate movement in your birth. Decline, if they give you an option for morphine, don't take it because, I mean, if you need it, it's something for you and your provider to talk about. But if you're taking a narcotic drug, you will have to be confined to the bed. Another tip to facilitate movement is getting a hep lock for your birth instead of having the whole IV pole. And it's something I've never had a provider in a hospital so they won't let a mom do it. Basically what it is when you're admitted to the hospital, you just get a little not a catheter, I shouldn't say. It's a little valve for the IV. So the needle's in there with a little valve. And you just have that attached and taped to your hand instead of having the entire IV set up. And then if in the case you do need an IV, you already have the portal for the IV and they can just quickly slip it on you. So movement, great. Hep lock, great. Narcotics, you'll be confined to the bed. If you get an epidural, also, a lot of women don't know this, you will be confined to the bed. If you end up having an epidural, there are still positions and movements that I'm actually going to physically demonstrate that you can get into to help your labor. All right, so if you'll excuse me for a minute, I'm going to go get, and I have to apologize beforehand. I typically teach childbirth ed classes with groups of pregnant mamas and their boyfriends and husbands, and I always have a pregnant female subject to work on, which makes a lot of sense physiologically. But because of the social distancing, I'm having to use my husband as the pregnant woman, wearing my 4-month-old child. We're gonna go over there. So
Late term pregnancy is hard. Oh, my back.
you're not on the camera, dear. So I'm gonna get up, position my computer, and I'm gonna show you hands-on how to do some of these, basically the best movement and comfort measured techniques, hands-on techniques that I use pretty much at every birth to help alleviate pain and to help mothers labor progress, if that makes sense. So the things I'm going to demonstrate, just so you know, you might have seen these already if you've been watching birth videos or YouTube or reading birth books. I'm going to go over the double hip squeeze, back counter pressure. These are all super easy. Massage and light touch. Actually, I probably won't go too much into that. I'll explain that right now really quickly. For massage and light touch, I would say talk to whoever is going to your birth and whoever is attending your birth about watching for signs of stress or strain in the face, and just having a light touch, telling them to touch you very lightly on the forehead to signal you to release those muscles. If they see you kind of tensing your shoulders during the birth, just explain to them that you would like them to just put their hands on your shoulders and encourage you to relax. Again, having your muscles and your whole entire body relax during the labor process is going to help it go quicker, and it's going to help your body to labor better and more effectively, if that makes sense. So we want to watch all these places of tension. Your hands, if you start to clench your hands, remind whoever is with you at your birth, hey, watch for me clenching my hands, because that's causing your whole body to tense. And just tell them to maybe do a little hand massage. Nothing too complicated. Just have their hands on your palm and massage them, shoulders, and everything like that. Those are kind of my go-tos. The forehead, the jaw, the shoulders, and the hands are kind of my go-tos for massage and my touch. So I'm going to go over the double hip squeeze, counter pressure, and just how to use a birth ball during labor. And I will also go over the peanut ball. If you're not familiar with what the peanut ball is, it's one of my favorite tools to use for epidural births. It basically gets your body in a really good position. Even though you're restricted to the bed, it keeps that pelvis open while you're still resting. So those are kind of my go-to movements. And I'm going to move the camera and I'm going to demonstrate. Let's see, hopefully, this is my husband, John, and my daughter, Mary Claire. Yep, and let's see here. I'm going to get this out of the way. To make sure that you guys can see what we're doing here, because I'm going to be on the. That doesn't help.
Are we going to be on the carpet?
Yeah, I see. Sorry about this, guys. Okay. So, let's see. Right here. Could you go just kneel down, leaning forward on the ball? Okay, so hopefully you guys can all hear me. Can you move forward just a little? I'm going to demonstrate the double hip squeeze. The double hip squeeze is great for pretty much every phase of labor. It relieves back labor if you're experiencing a lot of labor in your back, and it relieves a lot of the contraction, pain, and pressure that you feel at the front of your uterus during contractions as well. Also physiologically, you'll see once I actually do it, you'll also see that I'll be applying pressure to the iliac crest of the pelvis. And what that does, so your pelvis is kind of cupped like this. When you apply pressure to this top part, it actually opens the bottom part of the pelvis wider, so that as the baby's going through the birth canal, it creates more space for the baby to descend, if that makes sense. So I love using this at every point in the labor. I've used it at every labor, pretty much that I've ever attended. And it really helps with a lot of the contraction pain and makes it more bearable. So it's pretty much my go-to. So how you do it is you first want to find the iliac crest. Now on a pregnant woman, it's a lot different than a man. my husband, you'll actually feel it flare out a little bit more. So there are that bony kind of cracks that you feel, right? You want to go just below that. And I want you to think about, if you've ever played basketball, you want your hands like this, right? Just kind of like you're about to pass a basketball, right? You want them like this. You're going to find that portion, so you'll find the crest kind of right here. You want to go just below it and squeeze in and up. And a lot of times I like to incorporate this with moving side to side, which helps jiggle that baby even more into the pelvis and helps the mom kind of work through her labor pains. So that is the double hip squeeze. Remember, you want your hands like you're about to pass a basketball, and you want to squeeze in and up. Now, if you were coaching your husband, your boyfriend, or your mother through this process, have them do it a couple times. Even when you're pregnant, it should feel good and should relieve a lot of that pressure up forward on your pelvis and in your lower back that you're feeling, especially in late pregnancy. So have them do it a couple times, and you should feel an instant relief even without being in labor. And once they kind of get to the right spot, just give them that reassurance and say, okay, you got it there. And then in labor, let's say they do it and you're not quite feeling like it's helping, ask them to do it a couple times. Perhaps they're just not in the right spot. And I guarantee once they're in the right spot, you're going to feel it. Okay. Number 2 is counter pressure. Super easy. I especially use this if a mom is experiencing back labor, and that's where she feels most of the labor in her lower back. Not pleasant. I've had it for both my kids. It's pretty horrible. But the thing that saved me both times
Was me.
was him doing counter pressure on my lower back. A lot of people will want very direct, hard pressure. That was what I wanted. I've also had people that just wanted light massage, touch, kind of like a surface, like a skin, almost like a fascia, the light tissue stimulation that kind of just distracted them on the surface level, and other people just like very direct pressure. You can use a tennis ball, you can use a massage ball, whatever you want to use, or a fist if you want the direct pressure, and if you want light touch and light kind of like muscle distraction in that area, you can just have that person use their fingertips to lightly graze the lower back. But I will demonstrate, I will demonstrate what you would do with a fist or a tennis ball. You basically look for, I call it the butt dimple spot. Some people have butt dimples here. They're like 2 little dimples right at the top of their pelvis. I usually go right in the middle, and I apply my fist, just direct pressure. And even if you're pregnant and not actively in labor, this should feel good because it will release a lot of that pressure on your lower back, and it's providing counter pressure to that area. All right, so that is the counter pressure. And thank you very much, dear. I'll need you for the peanut ball, and you might want to put her down.
Okay. When?
After I do the birth ball. All right, next I'm going to go over how to use a birth ball in labor. I mean, even just sitting, so when you're sitting on it, you first want to make sure your feet are both firmly planted on the ground. And as far as the height and the size of the ball, you want to be kind of like I am. You don't want to be so low where you're almost like squatting, and you don't want to be so high that your knees are hyperextended. You want to be just comfortably sitting like I am right here. I'm going to give you a side view. And you can always inflate your ball more or get a different size. If you want to bring your own, that is perfectly fine. If you're doing a home birth, great, you have your own ball at home. If you're at a hospital, most hospitals have these. A lot of people like to bring their own because they're not sure how clean those balls are. Whatever your preference is, pretty much every hospital I've ever had a delivery at has had one of these, but I brought my own every time. So just food for thought. And when you're in labor, sitting on the birth ball is great because, again, it promotes you sitting upward and kind of forward almost a little bit, which is, like I said, one of the best ways that you can promote your baby being occiput anterior, which is the best way for them to exit your, enter the pelvis and exit through the birth canal, occiput anterior. And you can sway side to side once you have that good posture. One of my favorites is doing just a circular motion like this. And when I teach this in class, I often, if you ever watch SpongeBob, he does the bring it around town. I know, y'all are laughing. That's exactly, everybody laughs in class. But that's the best graphic I could give you for how to properly utilize a birth ball. You just kind of bring your hips in a circle. And do that a couple times. And then make sure you also go in the opposite direction for roughly the same amount of time. Because believe it or not, rotating your body in one way consistently can actually cause your baby to turn. And if your baby is optimally positioned, it might make your birth a little bit longer, but we can get into questions with that. So just make sure you kind of do it evenly both ways, clockwise and counterclockwise. So that's laboring on the ball. And John, yeah, your turn. And lastly, we'll go over the peanut ball, and then I will open it up to your questions. All right. This is a peanut ball. Kind of looks like a Mr. Peanut. Again, most every hospital that I have facilitated a birth at has had one of these. You just have to ask. And the nurses, for the most part, it's becoming more mainstream. A couple of years ago when I was starting out, it wasn't so well known. Nurses didn't really know what it was. They would look at me when I brought it out. But nowadays, it's actually, most nurses know how to use it, and they're very excited about it because it reduces birth times. And I can't remember the amount of time, but it significantly reduces birth times. It's a great tool to use when a mom has an epidural because it keeps the top part of her pelvis open. So again, if you're doing a home birth, you can still use it if you're trying to take a rest, or a home birth or a natural birth. You can still use it. Let's say you're in early labor and you want to rest, but you want to keep that top part of your pelvis open. Great tool to use. So the best way to apply it, I think, yeah, this should be fun. Yeah, I'll have you demonstrate both ways. So you basically insert the ball. Now straighten the bottom leg. You want your bottom leg straight, and then you insert the peanut ball, and then you rotate those hips and that top leg kind of down, and just rest like that. Now I'm going to have you rotate. Okay. You got it? Okay, rotate so they can see the other side. So bottom leg always straight, and then top leg, you want to do an exaggerated lie, like that. And that really keeps that top part of your hips open. They're kind of flared like that, which is great for promoting that baby to descend into the pelvis. And you do all that while you're laying down. Thank you very much. And again, if you're doing a hospital birth, most nurses know how to properly apply this. And they'll be very happy that you want to use it because it'll be your labor, more than likely, will be shorter. All right. And before we go into your questions, oh, that's right. I almost totally forgot. We're going to talk about COVID-19, and I'm running a little bit late, but I honestly this won't take too long. And then I will get into your questions. So the first thing I'm going to say about the pandemic, it more than likely has affected the hospital, or unless you're doing a home birth, it's going to affect how many people you can have and some of the hospital policies. Now, in order to find out what your facility policies are, I encourage you to call and figure out how your doctor is handling them and then how your specific hospital is handling them. The way that health care facilities and hospitals are addressing the pandemic is different. I've seen it different across different hospitals just in this one little area here in New Jersey. So I encourage you to call your provider or at your next prenatal appointment, talk about basically how the pandemic has affected your choices during your birth. Just to give you some examples, here in South Jersey, Moms cannot have a water birth at that one hospital that we have that allows it here anymore. So no more water births. Basically one person is allowed in the birth, but they can't leave. So for example, typically as a doula, I go, and then a family member, husband or mother, also attends the birth. Now mothers are having to choose between having their doula there or their husband or whoever. You can only have one support person at the hospital. So no water birth, and then one support person, and that support person can't leave for the entire process from the time you enter there to the time you're discharged a few days later after you have the baby. So I encourage you all to talk to your healthcare provider and then call the specific hospital that you're giving birth at. If you have a home birth planned, this won't affect you more than likely. But if you are birthing at a hospital or planning to birth at a hospital, this is going to affect you, unfortunately. But as far as this specific infection and pregnant and breastfeeding women and infants, the numbers, surprisingly, basically show that pregnant women are not more susceptible. In the medical community, most medical journals cite that pregnant women are more immunosuppressed and they're more likely to get a serious illness. But as far as COVID-19 is concerned, that is not true. Pregnant women are no different than anyone else, and they're not more susceptible to the infection, which is great news. More good news, there's no evidence to suggest that this disease or this infection is vertically transmitted, meaning that it is transmitted from the mother through the umbilical cord and the placenta to the baby. So even if the mother has it, the pregnant mother has it, doesn't mean that her baby has it. This could all change, but as far as what they know, they have not seen that there's vertical transmission. Great. It has also not been detected in amniotic fluid, in the baby's cord blood, or in breast milk. Also fantastic news. As of today, there have been no cases of maternal death in pregnancy due to COVID-19. Great news. Also, if a mother is COVID-19 positive, there have been no birth complications cited because of COVID-19 specifically. There might have been other birth complications completely outside of the infection that would have happened anyway, regardless of whether the mother had the infection or not. But basically what we know, hey, this infection has no effect on birth complications. Great. Also, as of today, there have been no infant deaths in the United States due to COVID-19. Now, a lot of you are asking, wait, I saw that there was an article saying that there was an infant death in Connecticut linked to COVID-19, and then there was another in Louisiana and Illinois. Yes, the key word there is linked. If you actually dig into the article, the babies that were under 1 year old that died all had either home accidents, and then when they were admitted to the hospital had tested positive but were asymptomatic, but died of other causes essentially. And as of the CDC's website today, there have been 0 infant deaths under the age of 1 in this country specifically caused by the infection. Great news. So if you're seeing headlines, I highly encourage you to actually click on them, because the headlines will say, oh, infant death linked to COVID-19. Didn't say caused by COVID-19. The headlines have been kind of deceptive, and I've been trying to stay on top of it because, again, I serve pregnant mothers in this area, and there's been a lot of panic and a lot of worry, and they're sending me these articles, and I'll actually click and read, and then I say, oh, it wasn't actually because of COVID-19. And that's not to say we throw all health practices out the window. We're still washing our hands. We're still doing social distancing, etc. We're being careful. We're being safe. We don't want these babies to get this infection. But basically, from all the numbers as of today on the CDC's website, there have been no infant deaths of COVID-19. Also great news. If a mother tests positive, a lot of hospitals, depending on where you are in the country, I know in New York City, at least at Columbia University, they are testing every single maternity patient that is admitted to the hospital for COVID-19. And Columbia University in New York City also conducted a study on their maternal patients, and they found basically most of the information I gave you was from that study. And they are suggesting that hospitals throughout the country test pregnant mothers before they come in, so that way they can take precautions when the mom has the baby. Probably not a bad idea. Now, if you test positive for the disease, that'll mean they will make you wear a mask, so a respirator, like those N95 masks for the birth process. And they'll probably make you wash your hands more, and the staff will have that protective gear on as well. Not really a huge deal. Also, as far as breastfeeding is concerned, the CDC and the International Lactation Consultants Association, basically all the sources across the board, highly recommend that mothers still continue to breastfeed, and that even if they are COVID-19 positive, they should be breastfeeding their babies if that is a choice that they want to make, and that it shouldn't be impeded based on your diagnosis. If a mother does test positive and she wants to breastfeed her baby, basically what hospitals are doing is having the mother put on the N95 mask and wash her hands before she feeds the baby. Actually, if the mother is COVID-19 positive, the CDC and the International Lactation Consultant Association are actually recommending that mothers breastfeed, because breast milk, a mother's body will produce specific antibodies for her baby that she transmits into her breast milk and gives to the baby through feeding to help that baby fight an infection she is exposed to. So I don't know if I explained that well, but in more simple terms, a mother's breast milk will pass on antibodies to her baby if she is infected with or exposed to any disease, to help her baby's immune system bolster against that specific disease. So, all right. That being said, that is COVID-19. And before we get into questions, I wanted to say, if you are pregnant, this is a very hard time for you, and I'm very sorry if your shower or your birth plans have gone to the wayside. I know that for a lot of my clients and friends, that's the case. But I want to encourage you to be hopeful and happy, and and just remember that your baby is a beautiful gift in this, uncertain time, and your joy shouldn't be robbed. And I know that that's kind of a hard thing to say, but you shouldn't be robbed of your joy, because it is such a gift. And this baby will be the love of your life, despite anything that's happening on the external world. And you shouldn't feel anything but happy and joyful. And I hope that through this little webinar session that you feel more confident and joyful, and have some more tools in your toolbox to help you have a good experience. So with that being said, are there any questions? And I think I saw some in the chat box. All right, let's see. If you have a question, please type them in the chat box and I will answer them in the order that they are given. Okay. All right. So I see that Katie has a question. I will be having a VBAC, and the hospital requires constant monitoring. That is a pretty common practice. I would love to use their birthing tub, but I'm thinking this won't be possible. Intermittent C-section. Yes, I have heard of intermittent monitoring for VBACs, but again, that's hospital specific. What I would encourage you to do, a lot of hospitals actually have wireless waterproof monitors. I would say that most of the hospitals that I attend births at have wireless waterproof monitors. If that's the case, that's a great way to both have them be happy because you're being monitored, which is a good thing. And I don't want to get too much into, I actually just finished a course on VBAC births, and I'm working towards becoming a VBAC certified doula. I'm a VBAC trained doula, so I've been specifically trained for VBACs, but I don't want to get too much into it because we'll get in weeds. But there is basically fetal monitoring or continuous fetal monitoring can help them detect if a uterine rupture is happening. So that's why a lot of them have that policy. But yeah, I would definitely look into the wireless monitors, wireless waterproof monitors. And if not, talk to your doctor about maybe doing intermittent monitoring. One thing that I always encourage my clients to do, you don't know until you ask. And a lot of people feel like they can't ask. And let's say your hospital has a policy. If you have your doctor sign off on a birth plan or sign off, I encourage my clients to write a letter or have a little written birth plan with some things they specifically want for their birth, talk to their doctor about it and have their doctor sign off on it. And that way, when they go to the hospital, they can tell the nurses on staff, hey, I understand this is the general procedure, right, with VBACs, but my doctor said I'm a VBAC and he or she is comfortable with me doing intermittent monitoring, and here's their signature. You're a lot more likely to get what you want if you ask and just talk to your provider about it. But again, like I said, wireless monitors, wireless waterproof monitors, ask about them. More than likely, they probably have them. Oh, birth centers, yes. I would love a birth center at the Guiding Star. That would be amazing. Drinking caffeine. Hello, Meaty. All right, drinking caffeine, is this okay? So in moderate amounts, one of my favorite books is Expecting Better by Emily Oster. And this author specifically combined a whole bunch of global studies regarding pregnancy and birth. So generally, I think it's, is it 100 milligrams? Basically 1 cup of coffee a day, totally fine. If you're pushing all right, we're having 2 or 3 cappuccinos or espressos, that may be a little bit too much. But coffee in moderation, a cup a day, shouldn't have any effect on your pregnancy whatsoever. Hope that answers your question. Anybody else have questions? But yes, Emily Oster is Expecting Better. She talks about deli meats, all the controversial stuff. So deli meats, sushi, alcohol, caffeine consumption, all that stuff. And she presents all this evidence and all of these studies from around the world regarding those topics. And it's a really great book. So I'd highly recommend it if you're pregnant or planning on becoming pregnant. Ooh, 23 weeks recommended to drink for raspberry leaf tea. Okay, so raspberry leaf tea. Different women react very differently to raspberry leaf tea. First thing I would tell you is talk to your provider about proper dosing, if that makes sense. For some women, if you start taking raspberry leaf tea and you are not at term, you may notice that you are getting very frequent uterine contractions. So typically the first thing I would say, sorry, this isn't so organized. First thing I would say, talk to your provider, make sure that they're okay with you drinking it. Second, when you start drinking it, if they give you the okay and you start drinking it, and let's say you're preterm, like 23 weeks, 20 weeks, whatever, and you notice you're having some very frequent contractions, I would say hold off on drinking it until you're at term, because I have a friend of mine who drank a whole slew of red raspberry leaf tea at 36 weeks and immediately went into labor. But then there are people like me. I drink red raspberry leaf tea like a fish, and I still almost went to 42 weeks pregnant with my son. It did nothing for me. So it's person dependent. But if you start drinking it earlier and your doctor gives you the okay, if you're getting frequent contractions, I would say just hold off until you're at term. So that way you're not having a preterm baby. Hope that answers your question. Okay, how can I help as a mother-in-law? She is too shy to tell me how she is feeling. Okay. She's too shy to tell me how she's feeling. Oh, I'm trying to think. Are you, Meaty, I'm hoping I'm saying your name right. Are you attending the birth, or are you just hoping to help her in pregnancy? Oh, I see you, there you are. Can you be a little bit more specific? Because I want to tailor this to your specific situation as best as I can.
Can you hear me?
Yes, hello.
Hi, sorry. I didn't know if I'm very slow in typing. She's very, very nice. I'm very blessed to have her, first of all. But I don't want to impose, and I don't know what I can do. I'm not going to be there, of course, because of the COVID. And I don't want to be the the person that will just stress her out. I like what you said earlier. I love that. I love her to death, and she knows it.
I love my mother.
What can I do? She's gonna give birth at the end of this month, and she's so worried about. I know she was worried about the COVID, and you know, the baby and being away from my son. But what can I do to ease her, you know, all this anxiety on her?
So first off, I would share with her, if you want, I can put some of these. I don't even need to, like, you could just do a quick Google search and figure out, if you just explain to her what you learned, that, I mean, pregnant women aren't more prevalent, that so far.
I wrote it down.
Good. So tell her that there is some good news here. And I think that that's important, because I feel like there is a lot of people are very afraid and hysterical right now. And that's understandable. I mean, it's a serious disease, but I feel like it's putting a lot of undue stress on mothers, and they somehow think, oh, they see all these headlines that these babies are dying. And just, so give her that good news that I told you. And you can do a quick Google search, just search CDC infant mortality from COVID-19, and you'll look at the numbers from today. I mean, it's 0 from the actual disease, so that's good. And the fact that pregnant women are more susceptible, also good news. But as a mother-in-law, I would say my mother-in-law was fantastic. Even though I didn't want her in the birth room with me, what I encourage my moms to do too, and I did it myself, is I made a list of groceries that we use every day, like the kind of milk I like, the kind of yogurt, cereal, all that stuff. And my mother-in-law, I had a list right on my fridge, and she would go to the grocery store for me. For you, that might look like grocery pickup right now, whatever means you're getting food, and just do groceries for them. That's such a big help. Meals, also wonderful. Is this her first baby too?
No, this is her third, but I'm not very, the first child is not from my son, but the two ones, I wasn't really there, because she also have a mom, of course, but you know, that's a mother's job most of the time anyway, her mother. But I wanted to do more for her. I just don't want to, I don't know how to approach it. You know what I mean? Like, I don't want to be the bad mother-in-law. I wanted to be the mother-in-law that can help her in any way. And she kind of know that, but I think she's too shy to ask. So cooking meals, you said, that's kind of nice.
Shopping, maybe taking, I don't know how comfortable you are with the whole social distancing thing now. That kind of complicates things, but maybe taking care of those other children. So she has a day or two with your son and their baby to just bond and kind of get used to feeding, and they're sleepless, and just having someone else that they trust taking care of the other kids is a really big help. Making meals, maybe going over, cleaning. My mother-in-law, I love when she does this. Every time I have a baby, she bleaches all my bathrooms. She cleans my bathrooms, and I cannot tell you how wonderful it is to have a clean bathroom.
Okay. That's a good advice. I appreciate that. I really do.
No, so that was always great. Also, my mother-in-law came over, and she will, my husband was still working for both my kids, and she came in and she's like, you know what, you go take a nap. I'm going to hold this baby for you for however long. That was a really big deal for me. And I would encourage you, I mean, these are just some things that I really loved when I was having babies that my mother-in-law did. But I would encourage you to just tell her what you told me, just saying, hey, I love you very much. I want to be as helpful as possible, and I don't want to be in your way. What is something I could do to make you feel loved and cared for when you have this next baby? I know this is a hard time. And just open up with her. And even if she is shy, she might be more inclined, if you really lay everything out, to tell you what she needs. But just from what I've received, that was really helpful for me and a lot of my clients. Those are the few things. And I hope that helped.
Yes, it does. Thank you so much. I appreciate that.
Congratulations.
Yes, we're excited. We're excited. I'm just seeing her, worries. And I was coughing for a while because I have asthma, and I didn't come over for 3 weeks, and I missed them. And when I went to see her the other day, she was in bed, very tired. Of course, she's still working, but she was very tired. And I was like, told my son, I hope I didn't impose, because I brought them dinner. She couldn't eat because she wasn't feeling well. Oh. But I felt bad because I thought, well, maybe I should not be even there. I didn't know what to say. So the communication, we're not really, she communicates with my husband more than she does with me. I think I don't know what it is, but like I said, she's wonderful. I just don't want to be the mother-in-law that a lot of people talk about sometimes. And I like what you said. I love my mother-in-law, but I don't want her to, they can stress her. I don't want to stress anybody. I don't want to put any stress on her. So yeah, with new home, new baby, new everything. I mean, at 2-year-old, she just had a 2-year-old baby.
Oh, wow. Yeah,
She's
I've got one of those. I'm not enjoying it. I love my 2-year-old son, but he's crazy right now. And I just had another baby. So having someone take care of him, I had someone that came. My mom wasn't able to come. My mother-in-law wasn't able to. She didn't want to come right away because my mom, it's a whole thing. But having someone take care of my son for those first couple of days was fantastic. That helped me so much. So maybe something like that would be really helpful.
I'm texting her while we were talking. Like, I'm listening to this lady from webinar. But anyway, thanks to Tricia, by the way.
Well, I hope that helped. And I'm going to put my email in here. So if you guys have any more questions, feel free to email me. Yeah, I don't know. Felony, you let me know if I think I'm trying to see. I think I have one more question. Okay.
Yeah, it looks like Katie had one more in there.
Okay. I'm going to read through this scenario. Okay. Do you mind, Katie, if I share this whole, I don't want to share too much personal information. Oh, you already wrote in the chat, so I guess it doesn't matter. Okay. I think I went to the hospital too early, started at 5 centimeters, was dehydrated, had a cold and couldn't breathe through the nose. Okay. Yep. 45 hours later, had my daughter. Wow. You are a warrior. That's wow. Well, what would you suggest not to have as long as labor? Okay, an epidural at 35. Girl, you and I have very similar first labors. Sorry, I'm laughing, but it's just like I read this, and I have so many clients that have first labors like this. So yours, I will tell you, was 5 hours longer than mine. So I think that you're an absolute.
I didn't beat my mom. My mom was 56 with me, so it runs in the family apparently.
Okay. So you stalled at 5, was dehydrated, had a cold. Okay, so I actually had bronchitis during my last labor. Not fun. You can still breathe through your mouth, and ideally through the nose is great because it kind of like runs through your whole body. You know what I'm saying? It's better for diaphragm breathing. But for my last labor, I was actually like, if you have that scenario again, just breathe through your mouth. Nice and slow. Hold it kind of once you do the inhale, hold for a couple seconds, and then exhale. And that relaxed jaw is really, really key to help your whole body relax. So that's what I would say about that. Just breathe through your mouth. What would you suggest not to have as long of a labor? That is something, I mean, I was a doula for 2 years before I had my son, and I still had a 40-hour labor. And like you, I labored naturally for like 32 hours. Then I had a swollen cervix. I stalled at like 5, had a swollen cervix, so I actually stopped dilating.
Oh no.
And then they're like, oh, the baby's going into distress. It looks like a C-section. I was like, oh gosh, please, this is not what I want, like not after all this time. So I got the epidural and I said, hey, if I lay down and relax, maybe this baby's heart rate will get better. If I relax, I could just lay down, because I couldn't lay down. I was in so much pain. I got the epidural. I was able to relax, nap. The baby's heart rate improved, and I ended up having a vaginal birth after 40 hours, not as long as you, but I understand this whole thing. The story is very similar. So a couple things to keep in mind. Second labors are statistically 50% shorter than first labors. So that's one important thing to keep in mind. So for the most part, they will be 50% or less. So you had, let's see, a 45-hour labor. So looking at half of that, what would that be? That would be like a 20-something hour labor.
24-ish, yeah.
And for my second child, I just had her in
22.
I had a 20-hour labor. I had a 40-hour labor with my son. That was exactly 20 hours. So, and it was a lot better. I'm going to be honest with you. It was a lot better. And I think having that expectation, so you can be hopeful that it'll be about half the time or less. You could be surprised and have a very fast progressing labor the second time. You just don't know. Your body's been through the process. Your baby is different. Your baby's a different size, it's a different head shape, all this different stuff. So keep those things in mind. So just because you had a long, difficult labor the first time doesn't mean that that's how it's going to be the second time. Now, as far as progressing for stalling, a lot of times that has to do with the environment. You'll have an adrenaline surge. And we talked about oxytocin, that's the fuel. If you have an adrenaline surge and there are bright lights or some person that's making you uncomfortable, or maybe you transferred to the hospital at some, let's see, how much the hospital too early? Yeah. If you transferred to the hospital really early, that is every single labor that I've seen at the hospital completely stalls. They'll be really, really well progressed, have a great contraction pattern at home. They'll be every like 4 to 5 minutes apart, lasting a long time. It kind of lasts in the car. As soon as they get into the hospital, it completely stalls for about an hour or two as people are asking you questions. You have bright lights. Sometimes moms will wait too long. If you're already in the pushing stage, it won't stall your labor. But if you're in the early labor stage, it'll just switching environments from a comfortable home environment to a hospital environment pretty much universally does. So, but I would also encourage you, you're a second time mom now, don't stay at home too long either. For first time births, you want to make sure you're in a well-established contraction pattern. So that way when your labor stalls a little bit in the hospital, your body's already in gear and it's going to pick up, if that makes sense. If you transfer too early, just like I talked about with the tub, sometimes it completely stops. And then you go home and then it picks up like a day later. And yeah, is there anything more specific you want to ask? I want to make sure that I'm answering your question. If you have.
Right. I mean, and I think going into like, I know it's going to be different. It's just, I know there was a lot of different things that contributed to that long. I think I was not drinking enough. I mean, my urine was practically orange, and I probably should have been, should have been on an IV, but I had to have block because I was already confined with the stupid cords on the monitor. So I was confined to like a little 5-foot space. So it's like I couldn't walk at all. Which I think was part of it. So, and I think I got there too early because when I first got there, it was only 1 centimeter. Yeah. And it's like, well, I'll walk around for an hour, see what happens. And then I went from 1 to 3 in an hour. I'm like, okay, I could do 2 centimeters each hour. That sounds good. And then I even think after they broke my water and at the 35-hour mark, and it was a couple hours later, it's like, I mean, you're 5, maybe 6. And I swear she did the baby just to make me feel better. But I was just like, how am I going to push? I'm exhausted. I haven't slept in over 35 hours. I haven't eaten anything. I'm dehydrated. What am I going to do? So, but after getting the epidural, even though I didn't really want it, it ended up being the best thing for it. I just really would rather, I mean, if it's a 10-hour labor, I could do 10 hours. That's no problem after doing 45.
Now to be honest, your scenario, so epidurals aren't always bad. And in the natural birth community, like I feel like sometimes there are people that are like, oh, like, you gave in, or it's not what it is. A lot of labors, especially the labor that you had, it was probably the best thing you could have done, because if you were dehydrated, hadn't slept in almost 2 days, and then you get to the pushing stage and you're exhausted, your muscles are just done. Your body would have given out. That's a long, long labor. So that was probably the best thing you could have done. And my scenario too, I mean, there is a time and a place for an epidural, even if you're trying for a natural birth. If you're the person that wants to go in there and get the epidural right off the bat, that is your choice. It's a nice way to go, especially if it works well, because you can relax and you're not tensed. But if you're someone, there's appropriate time and place for everything. So I wouldn't feel bad about the decision you made. I think that was a very good decision that you made. And I say you just wait and see what this next birth brings you, and have an open mind. You have some tools in your toolbox, do some reading, watch some YouTube videos. You saw my video. If you have any other specific questions, I'm going to leave my email in the comment box. You can just email me. Okay. I'll get back to you because I'm just here at my kids.
Yeah, we're all inside, so yeah, we have nothing better to do.
I'd be happy to be available to you and answer any questions you have. I would just say go in it with an open mind. It's a different experience. You did a great job, it sounds like, the first time. I would just make sure you're staying hydrated. I recommend something like this. If your hospital doesn't give you, a lot of times they'll give you like a jug with a straw. Bring a water bottle with a straw and just make sure, if you have someone with you at your birth, whatever that is, make sure that they are telling you to drink between each contraction. That's what they should do.
Well, but their big thing was like, oh, well, you can't eat or drink, blah, 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 because...
They didn't have you hooked up to an IV?
No, they didn't have me hooked up to an IV. It was just a hep block.
That is a bad decision right there.
Well, and even the nurse said, man, we need to figure something out, like, because if you're not hooked to an IV and you can't drink, like, and I'm like, yeah. I was sneaking Gatorade when they weren't looking, but it wasn't enough.
No, so if I would confirm that. That's so weird.
That was at a different hospital though. I'm doing a different hospital birth this time, so I'm not quite sure their rules. I need to talk to my doctor. I'll be going to him in 2 weeks for a partial previa check, to make sure that it's moved.
I hope so.
Say again.
Fingers crossed.
Yes,
mine moved. Thank God, it was great. But I was
it was at 20 weeks. It was just partial. But and they're like, oh yeah, it'll move, no problem. But then put me on full pelvic rest. And I'm like, okay, if you're not concerned about it, then why are we doing this? Why would we do this? And at first they said 8 weeks, and I pushed back. I'm like, well, I'd rather know sooner rather than later, especially with the anxiety of everything. Like, can we just make sure that it's moved as soon as it does?
Yeah.
So, and then they moved it to 5 weeks instead of 8.
That is good. Keep in mind too, so as your uterus stretches, it's probably going to move.
Okay.
Like the bigger you get, just think it's a muscle, and that placenta is attached to a specific part of that muscle. And if it's only partial right now, I'm pretty optimistic, but typically what happens if it's only partial is once your baby and your uterus stretches more, it's going to move.
Okay.
So hopefully, is it anterior or posterior, do you know?
I don't remember. And I even remember seeing on the ultrasound, like, it was just barely eked over the cervix. So I'm like, okay, like that's, and the tech was like, oh yeah, no problem. You know, this will move in like 95% of the cases. I'm like, okay, great. And the first thing the midwife comes in, she's like, okay, well, we need to put you on pelvic rest. You know, I'm like, wait a minute. I thought we said this wasn't an issue. Like, why would we go immediately to pelvic rest? Like, and then I heard from other women that they're like, oh, my doctor didn't do that, you know. With full previa, I can understand that, but not partial.
No, full I can, but partial, no. Maybe, is she a new midwife? Like,
I'm not sure. She looks like maybe she's in her 40s.
She might be new. Sometimes, this is just me. Sometimes, just based on providers I see, again, I'm not a medical person. I don't want to get shot if there's a medical person. I find that the younger midwives and doctors are a lot more cautious. And I mean, I was like that too in any job that I did. You don't want to make a mistake, especially when you're dealing with like a mother's life or a baby's life. So I find that a lot of times the newer midwives and doctors, they're a lot more cautious. And that's not necessarily a bad thing. So maybe that's what it was. But you can go to your appointment and just clarify, hey, you know, well, it sounds like you're going to get that ultrasound in that. You might not.
Yeah, it's in 2 weeks. Okay. So,
I mean, you'll see, hopefully it moved, even if it doesn't, and let's say it doesn't, and your uterus still needs to stretch, just ask if they're still trying to impose that period of rest, pelvic rest. Hey, is there something that you're not telling me, or is this
right?
It's not a big deal, because you deserve to know the answer. And sometimes, you know, if you don't ask, either they're busy, they have a lot of patients, they do sometimes that, oh, I should probably explain my rationale here.
Mm-hmm.
But yeah, so I would just be optimistic. I think you're gonna have a good birth. You're gonna be pleasantly surprised. And if you were able to do a 45-hour birth, all right, you got this.
Thanks.
You got it in the bag. And so you're having a baby in the summer. That's so exciting. All right, anybody else have questions?
Any other questions?
Mary's losing it. I'm coming, Mary.
I know, I can hear in the background. All right, so we are going to let Lydia sign off on here so she can go take care of little Mary for us. But just some updates. So check out our website, guidingstar@theshores.org. Our next webinar is going to be featured with Dr. Monique Ribeiro, and we're going to discuss sexual integrity and addressing unplanned pregnancies during the COVID and how to prevent them with some natural fertility options. So look for that. We are on Facebook, we're on Instagram. You can look us up, and those webinars will be posted shortly as soon as we secure a date. We thank you again for all of your support and for joining us tonight. Have a blessed night. Lydia, thank you again for all of your help. We look forward to working with you in the future.
Thanks, Melody.
All right. Have a good night.